Hello. Today I'm going to present my solution proposal for human rights issues. It is based on health and economic growth. Human rights problem, health and economic growth. Based on the data from the World Health Organization, both developing and developed countries suffer from health-related issues causing deaths. These issues are illnesses, lack of access coverage to health insurance, poor quality, high incidence of disease in workforce. Health. Symptoms of the problem, half of the world lacks access to health services. 100 million people are still in extreme poverty. 800 million people spend at least 10% of their income in health, forcing them to survive under less than $2 per day. One third of the world population does not have access to the medicines essential to their health and survival because of high prices. 24 million children from the poorest countries did not have access to the basic vaccines. 40% of mothers who give birth without any medical assistance, as you can see in these pictures. Well, my proposed solution as a world leader, the solution consists in creating a global endowment that can provide enough funds for developing economies to improve healthcare, as you can see in this chart. So I'm going to give some slides to explain the data supporting public health expenditures. According to the World Bank estimates, for developing and middle income countries, a 10% increase in public health expenditures as a proportion of GDP results in 7% decrease in maternal mortality rate, 0.69 decrease in child mortality rate, 4.14% decrease in low weight for children under 5 years of age. Therefore, the increase in public expenditures as a percentage of GDP is associated to a significant improvements in life expectancy and quality of life. More data supporting public health expenditures. According to the World Bank estimations, for developing and middle income countries, an increase in public expenditures backed by a transparent economic policy may result in alleviation of economic burden of illnesses, improves child education as it increases quality of life for children, provides more resources for parents to send their children to school at early ages. Also reduces work-related issues. Also improves productivity and enhances production as a result from healthy workers. The economic impacts that health improvement has on society are noteworthy. Empirical data retrieved by economists have shown that economic growth has been positively associated to improvements in population, food consumption, and access to better healthcare systems. Some examples are England, 33% to 50% of economic growth in the past 200 years attributed to health improvements. In Latin America countries, Mexico, Peru, and Colombia have positive correlations between health and growth. Other supporting facts: increase in life expectancy from 50 to 70 years, which is basically a 40% increase, would raise the growth rate by 1.4 percentage points per year. A 10% decrease in malaria is associated with an increase annual growth of 0.3%. Also, malnutrition causes a decrease in the annual GDP per capita growth worldwide of between 0.23% and 4.7%. In conclusion, empirical data shows that health, being measured primarily as the likelihood of survival over a period of time, has a strong and significant correlation with economic growth. This is much so in developing countries. There are risks associated. Possible risks associated are the public expenditure program fails to address the most urgent healthcare issues. The resources are misallocated from their optimal uses, heavy public subsidized expenditures, and skyrocket prices. Lack of efficiency related incentives may compromise quality. Centralization of public services and public offered health insurance might threaten quality control, reduce competition, and limit choice for individuals. Also, high degrees of wasted resources, as a high bureaucracy to support the program can enable corruption if not managed properly. Benefits outweigh risk involved. Empirical data show that over a study encompassing 170 countries, there is a strong correlation between life expectancy and real GDP per capita. What this means is that targeting public health and promoting its access addresses life expectancy issues, years of lost disability, and illnesses. Thank you very much. This was my presentation for today. I hope you liked it. In the bottom of thank you, those are my references to make my presentation successful. Thank you.